Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. It's finally beautiful outside. Absolutely stunning. And you know what? I love you more than the weather. That's why I'm here. But you got to get outside and go for a walk or travel the farways and byways and enjoy the day. After my program, obviously. We're broadcasting to you from 105.9 FM and 6:30 AM WMAL. Love to talk to you on any subject you have in mind, no matter what it is. 888-630-9625. That's 888-630-WMAL. Perhaps you've had a problem and you've tried, you've applied, you've come up with the same old thing. Nothing that works. Well, here's your opportunity. Here's the capacity, the bully pulpit. This is the place where you find out how to do it, how to really make things work. And remember, where you are right now in your health, at this moment, in your wellness quotient, is because of everything that you've done up until this moment of time. There are no accidents, friends. It's a timeline. It's one that if you follow back and you ask the questions, structural injuries, biochemical imbalances, emotional stresses, that's what got you to here without knowing what to do about it along the way. Well, that's why I'm here, to help you put the fire out, so to speak, and make a difference. Before we get started in the program, we want to let you know about something. The Roselle Center for Healing, several times a year, but this is a very special event coming up in about 2 weeks. We're teaming up with Caring for Others, a 501c3 foundation. Caring for Others has as its mission scholarships for integrative care facilities, setting up temporary transient missions for people who have nothing, and in addition to that, public information, but also importantly trying to help other charities bring food and shelter and so forth. So we're teaming up with them, and the week of the 6th of February through the 11th of February, I'd like to invite you to join us in collecting non-perishable foods for the local food banks. And here's how it's going to work. Those of you who have listened to the program for years in some cases and have thoughts about talking to one of my doctors, one of my associate doctors in the practice, want to see one of my acupuncturists or any of our practitioners, normally, initial consultation in the office is $225 up to a lot more than that. So what we're going to do for you is we're going to exchange that. We're going to allow you to make an appointment to come in to see one of my doctors for an exchange. And what we'd like you to exchange is this. We want you to bring a bag of food. If you will bring food into the office, or if you don't want to bring a bag of food, at least $50 donated to Caring for Others. Now, it's a total tax deduction to you. Roselle Center for Healing and Caring for Others will match it. So it's a triple play. We will match whatever you donate. Whether it's food, we'll figure the value of it, and we'll put a monetary value on that. If you come in and you donate $50 for an examination, a chiropractic examination, or an acupuncture examination, we will match that twice. Once from Roselle Center for Healing and once for Caring for Others. And in addition to that, I will pony up some cash on top of that. We're trying to make, there's a lot of people suffering out there. There's a lot of people who need us. And we'd like to use our position in the community with your help to give you the care that you potentially need, but also to give people the things that they need to survive. If you'd like to join us, it will be February the 6th through the 11th, that whole week in the office. Give our office a call. It's 703-698-7117. That's 703-698-7117. And here's another piece of it, too. Some of you who've been patients over the years and, have kind of been putting off coming back and, talking to one of the docs again and so forth. If you are a patient who would like to come back in and, you've been putting off financial reasons, you don't want to do the re-examination fees and so forth, we will exchange with you as well. All you need to do is call our staff and say, hey, listen, I've been a patient of Roselle for, how many years ago it was or whenever it was. If you'd like to come back in, again, bring in a bag of groceries or bring in $50, and Roselle Center for Healing and Caring for Others will match that. And we will donate that to the shelters to help them raise food and donate food to those who are literally starving out there. Call our office, 703-698-7117. We're going to talk about a lot of things, and our phone lines are starting to log on here, and we will get to you today. But having the opportunity, there's some couple things that I want to share with you. It's called In the News, right? We're going to talk about vitamin D today. We're also going to talk about one of the primary reasons people die early. Some of us should be living life that is much fuller than what our expectations are. The problem is that we leave this life too soon, and it's not necessary because it's all preventable. But you need to know why, and you need to know what you can do to help yourself and turn things around. But in the news, there's several things that I think I'd like to share with you today. We often laugh and we tease, and particularly I get teased a lot, about resveratrol. Resveratrol is that very effective antioxidant that allows the aging process to really, really slow down. And it's been used in many, many experiments. Now, we know that resveratrol comes in the form of wine. It comes in the form of grapes. It comes in the form of some other things. But those are the two things that you normally see. But they did some very interesting randomized crossover studies. And what they did is they took a whole bunch of guys who were really overweight. And then they took some placebo. So they did a double blind. And then they took their body fat index and measured their energy expenditures and how much fat they were actually storing in their body comparatively. And they began to use just resveratrol and to see what the outcome was over a period of time. And what they saw was huge beneficial effects of utilizing resveratrol supplementation. They used a concentrated form of supplement with it for 30 days on these healthy, otherwise fat people. And what they noted was that a lot of things began to change. Not only the degradation of cells, the breakdown of cells, but also increase of energy production and also output relative to toxins in the body. Very, very interesting, but it's out there. There was another interesting thing that we've been talking about forever, using fish oils or omega-3s for the prevention of and treatment of prostate cancer. This article was published in Cancer Prevention Research, and the researcher was a guy by the name of William Arneson, and what they said that there was a tremendous beneficial effect of using fish oils in retarding the growth of prostate cancer. And they did a trial that actually incorporated quite a few people, and it was only over a period of 4 to 6 weeks. And they did it with guys who'd had surgery, guys who'd had radiation, guys who elected not to incorporate any of those things. And they received fish oils at very, very high concentrations. And when they re-examined, they noted that there was a huge turnaround. There was a huge shift in the cancer and also in the healing process that these guys are going under. Your body will turn anything around. You just got to get things out of it. You've got to make a difference. And if you don't, well, then you're subject to more of the same old, same old. Let's talk about the overlooked leading causes of premature death just for a minute, because, all of us want to be around for a while. I got a lot of things left to do. And matter of fact, my goal is for over the next 10 years to do at least 4 to 5 times more than I've done over the last 25. See, I'm smarter now. I know what not to do. And if I focus and hone myself in, so that means I got to take care of myself. And if I don't take care of myself, then I'm not going to get to do all those things. And I'm not being facetious, by the way, when I just shared that goal with you, because that's really true for me. But one of the number one things that causes us to die early is that borderline or frank presentation of diabetes. And what is diabetes? It's high blood sugar. When your blood sugars get too high, you're in trouble. The problem is that physicians are failing to determine how blood sugar, low or high, and what the levels really need to be protected against all the complications of that imbalance. So there's been a lot of studies back and forth, and if you get into the literature and you start reading, go into natural healthcare and look up diabetes and so forth, or you look up research related to, and you're going to find all these things. It's really easy to Google, and you can go into Grateful Med, and you can go into PubMed, and you go into a lot of different journals. New England Journal of Medicine always has some great articles on it. And we're not talking about something that is kind of minor. We're talking about significant problems, because when blood sugars get out of hand, either too high or too low, it dramatically increases the aging process across the board. We have problems with the kidneys. We have problems with our eyes. We have problems with heart, our vascular system, leading into things like stroke, neuropathy, where you can't feel anything, or you get tingling or numbness that just is not associated with the normal neurological tracts, and cancer. I mean, it's all there. And it relates to the problem that comes about with blood sugars being either too high or too low. Why? Because of the inflammatory process. Do you notice that there's a theme sometimes when I start talking about things? Inflammation is the end byproduct of things that we shouldn't be doing, whether it's too much stress in the body, whether it's injury, pain that doesn't go away, or whether, we're just not putting things into the system, the fuel that we need to have. High blood sugar appears to be the leading killer across the board. Yet, unfortunately, it's not being diagnosed properly. The tragic result is simply this, that people are dying needlessly when their blood sugars spike, when it goes up. See, you can do a fasting blood test, and it may be normal. But if you take it down the road just after somebody eats, all of a sudden you see this thing just jack up real fast. Not a good thing. And people wonder why they don't feel good, or they get sick, or their heart starts beating real quickly, or they get pressure in their arteries, or their ankles swell, and it just compounds the irritation. So here's what the deal is. Diabetic rates have really gone through the ceiling, and they seem to also parallel the increased incidence of cancer. High blood sugars and insulin levels and adrenal function are necessary to determine your overall state of wellness. Unfortunately, it's not just one test at a time of blood sugar fasting. It's not just taking an A1C hemoglobin. It's looking at it from different pathways and different pieces. High insulin levels are believed to stimulate cancer cells. So if your pancreas is having to work really hard, because it can't get the blood sugar in, so you're demanding the pancreas to put out more and more insulin to transport whatever available blood sugar because your cells are saying, I'm not getting enough, then we know that you're going to predispose yourself to all kinds of cancers. But if there is a cancer present, it's going to increase its cellular proliferation. It's going to become much worse. There was a study that tracked in excess of 10,000 people for over 10 years, and there was a substantial increase in cancer in those patients who had a fasting blood sugar level over 110. Now that means nothing in your body for about 12 hours. You take blood in the morning, you see what the blood sugar levels are, and they did that, and they also said they measured it with a 2-hour spike after you eat. So you have your lunch, and then they took the blood after, and if that went up over 160 or at 160 or more, they said that there was a dramatic increase in cancer cell proliferation. So this is serious stuff. It's not only the fact that it can affect your eyes and your heart and everything else, it's the fact that if you got something underneath, your body's going to degrade. It's going to begin to break down. It's going to destroy itself. Serious stuff, friends, and we have to really get a handle on it. Remember, you're the culprit. You're the cause. It's because you're not paying attention. My job is to get you to pay attention and take ownership over what's going on and be able to turn this animal around.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, broadcasting 105.9 FM and AM 630 WMAL. You can reach me here at 888-630-9625. And we're going to go to the phone lines and see if we can answer some of your questions. I want to remind you that if you'd like to contact us off air, you can go to rosellecare.com. That's ROSELLECARE.com. And send me a note. Love to talk to you. If you'd like to talk to one of my docs personally, 703-698-7117. Laura, how can I help you? Thank you for calling.
Hi, how are you, Dr. Roselle? Thanks for taking my call. I love your program. It's very informative.
That's very kind. I appreciate it.
Thank you. In the past, I called you for my blood pressure, and you advised me to buy something. I can't remember what it was, and I couldn't find it.
You should have written me a note, and I would have told you where to go get it.
Yeah, well, I went to Whole Foods. They don't have it. I can't remember even what you prescribed. You said this was niacin, and something else would help me. But my main call today is about the supplements I'm taking.
Okay.
I'm taking a whole lot of supplements, and I don't know what is causing this allergic reaction. I itch sometimes, and it's so bad, and I have like a pricking sensation, like.
How long does it last?
Well, it lasts for a while, and then it stops after I keep itching. So let me tell you what I'm taking. I take CoQ10 200 milligrams. I don't know if this is too much. I take cinnamon tablets. I take lutein 20 milligrams, cod liver or fish oil, depending on what I can buy, you know.
Well, let me make it easy for you, because I don't think that I'm going to be able to find out specifically for you, but I can tell you some of the things that you could be sensitive to. Any of the oils, anything that you're taking in an oil form, because all the oils are different. It could be soy. If you're sensitive to that, then you're going to be sensitive to it, and you can have an itching reaction. Now, my first reaction to you is this: you may be taking a B complex that has some niacin in it, and niacin is going to cause the blood vessels to open up very, very fast. They're the smallest blood vessels in the body, and it's going to make you feel like it's burning and itching. And it goes away within about anywhere from 10 minutes up to a half hour.
Yeah.
And that sounds like a niacin flush to me.
Yeah,
so,
I do take niacin, 500 milligrams.
Yeah, that's what's doing it. I can guarantee you that's what's doing it.
How about glucosamine? I was told, I read about it, that it does cause, allergic reactions.
It can. Any of the supplements you're taking can cause an allergic reaction. It depends on how they're made. It depends on the formulation. It depends on the additives and the preservatives. In our office, when we prescribe something for the patient, we're only using organic forms from companies that are checked all the time. But when you go out into the marketplace, you have to look at the bottle, and you have to see how many other ingredients that are in the bottle. Those are the things that can cause you a problem. But why don't you do this? Start taking, either stop your niacin just for a short period of time to see if that goes away, or take your niacin after you've eaten about 2/3 of your meal, then take it. And I think that you're going to find that it'll be much less. And that's what it is. If it's the niacin and that's what's causing it, don't worry about it. It's not a problem. It's just the natural way that the body it's opening up the blood supply.
Yeah, I knew about niacin, that when I take it, this happens, and I read about it. Yes, it does happen. So the other things that I'm worried about is that, like, I take probiotics as well in the morning, those ones called Pearls, and I buy everything from Whole Foods.
Yeah, it doesn't matter, Laura. I mean, we give our patients excellent quality vitamins, and some of them show up allergic to some of the nutrients. Right. You can be allergic to lettuce. You can be allergic to an apple. You can be allergic, and the problem is that you have to identify what it is and then take it out. And send me a note, and I'll tell you what you need to do. Just go to rosellecare.com, send me a note, and I'll tell you how to eliminate some of the things to try to find out which one it is. But my guess right now is that it's niacin. Laura, thank you for calling. I appreciate it. Ann, how can I help you?
Hi.
Hi.
Good morning, doctor. My question is for my husband. He is a melanoma survivor. He had it a couple of years ago. And he used to have kidney stones as well. So I was trying to ask him to take vitamin D with me. I'm also a breast cancer survivor because it helps to reduce the reoccurrences. But he's afraid to take vitamin D because he believes that there's a huge calcium relationship, and he doesn't want to cause kidney stones. Can you help me?
Yeah, if anything, the vitamin D will allow him to absorb the calcium much more effectively, allowing the stones not to form. So
really?
So what you want to do is, one of the reasons that calcium comes out of the bone is because the body is too acidic. So the body tries to buffer it. It tries to bring it back to neutral. And the way it does it is by taking your stores of something that is alkaline. And the biggest store of alkalinity that you have is the calcium in your bones. So you have to make sure that you drink lots and lots of at least neutral water, pH is 7, better alkaline. Shift the diet so you're eating tons of vegetables. Get rid of the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, and so forth. And as far as red meat, you got to get that way out of the body. And you'll find that if you take magnesium, if you're taking in your husband's situation, I would take a magnesium glycinate form, and as long as it doesn't give him a loose stool, take it up as high as you can get it. You start at about 200 milligrams and then go to 200 more during the day and then 200 more to the day. And if you can get it up to 600 to 1,000 milligrams a day of magnesium glycinate without and the only side effect, by the way, is with magnesium glycinate is that you may have a little bit of irritable bowel at that level. And all you do is you back it off to where it stops and then stay at that level. So, but the vitamin D taken with magnesium, with eliminating those things we talked about, will actually do a lot to maintain his bone integrity, not allow him to lose calcium, and he, as far as forming more stones, he won't.
Okay, so I'm writing it down, doctor. So vitamin D with magnesium, just make sure it doesn't have the calcium in it, right?
Yeah, you just even with patients with men don't need as much calcium as women do, and you want to give them at the most maybe supplementally totally from everything, maybe 400 to 500 milligrams a day, but you want to dramatically increase the magnesium, but you also want to shift the acid in his body by doing those things that we just talked about, and that can make a huge difference. That's what we do with our patients, and you get some significant turnarounds. As a matter of fact, in the second half of the show, we're going to be talking about vitamin D today. So pay attention. I'll give you much more information. I appreciate your call. You'll get a lot of information when we come back after the news. So many people are afraid of taking supplementations because they really don't understand the whole story, and unfortunately, many of their physicians, well-meaning as they might be, don't understand nutritional biochemistry. And until you really understand how the body works with these things and the substitution, I mean, every time a physician tells a patient, I want you to take 81 milligrams of aspirin to prevent heart disease, I go through the ceiling. I said, do you know what you're doing, that there's other substitutes out there that are much safer and can prevent all kinds of things? We'll say, well, it prevents cancer. Well, so does, green tea.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630. WMAL, love to talk to you on any subject that has your mind. We were talking about what was going to kill you. Now we're going to talk about vitamin D, and we're going to talk about some other things. Mention a little bit of a few things that were in the news. But I also want to remind you again and invite you, truly want to invite you and encourage you to help us. The week of February the 6th through February 11th, Roselle Center for Healing and Caring for Others, 501c3 charity, are teaming up. And what we're teaming up to do is this. We're teaming up to raise food for the homeless shelters and money for the shelters. I want you to join us in collecting non-perishable food for the local food banks. So we're going to do that through our foundation, Caring for Others, and they're going to donate it. And let me tell you, inventory is really low, and there's a tremendous amount of need out there. In exchange, here's what we're going to do. We're going to help you help us, and we're going to help you. Many of you have listened to Dr. Tom Roselle Live for sometimes years, and you've been putting off coming into our office for whatever reason, so we're going to encourage you to do that. If you'd like to come in to have a full consultation, chiropractic, acupuncture examination, either one or both, normally each one of those things are starting at $225 and upwards. We're going to give that to you as our thank you for donating a bag of groceries or 2 or 3 or just $50. And this is what else we're going to do. Roselle Center for Healing and Caring for Others will match your donation. So this is a triple play. And then when it's all said and done, I'm going to add a check to it. And all of this is going to go to the food banks. Give our office a call at 703-698-7117. That's 703-698-7117. The week of February 6th through February 11th. So you need to call now and make an appointment. And when you come in, how you pay for your bill is by a check for $50 or cash for $50 made out to Caring for Others, 501c3 charity, so you can write it off, or bring in the groceries. Bring in at least a bag of groceries, the equivalent of about $50, more if you'd like. And remember, we're going to match your gift. We're going to figure out what the value of your groceries are, or you can bring in the receipt, and we're going to match that gift, and we're going to give it directly to the food banks. February 6th, February 11th, Roselle Center for Healing. Give us a call at 703-698-7117. Tell my staff you want to participate in Have a Heart campaign. You want to participate in the Have a Heart campaign. We thank you, but more importantly, the people out there really need our help. Let's go to the phones. Marie, how can I help you? Thank you for calling.
I wondered if you had any suggestions for lowering blood pressure without taking medication.
Oh, I got many suggestions for lowering blood pressure without medications. There's lots that you can do. First of all, is it you?
I beg your pardon?
Is it you?
Yes.
Okay. And let me ask you some questions. How old are you?
86.
All right. And what kind of medication are you taking?
Well, none yet.
Okay, so what's your blood pressure?
My blood pressure's starting to run high, and I'm wondering...
Okay, what's the blood pressure? How high?
Well, it varies, but the last time they took it, it was 150/70.
Okay, so for your age, that the top end is a little higher than what I like to see. The bottom is not a problem. Something very simple may drop it down for you in that particular situation, because if I start talking about just how do we lower blood pressure, there's many ways of doing it. Some people have high blood pressure because they've had injury to their body, so the skull and the pelvis aren't working, it doesn't move spinal fluid, and they build pressure up in their body, and it's recorded as high blood pressure. Some people have very high inflammatory levels, and that will trigger blood pressure spikes as well. But in your situation, the upper pressure, the systolic pressure, is the one that is of concern. Get yourself some magnesium aspartate. And a lot of magnesium works, but I think the magnesium aspartate will work better for you. And start out with about 200 milligrams and take it at nighttime before you go to bed, about an hour before you go to bed, and see what happens. And then you can increase it a little bit more, and see if it begins to bring it down. But when you see an upper pressure like yours, a systolic pressure high, but the lower pressure is still in pretty good shape, it's usually that the arteries are a little tense, and you're having to push too hard through the system to get it out into the smaller vessels. Take the magnesium. It will relax the system. Let me know. Give us a call.
I'm taking magnesium with... I have osteoporosis.
How much magnesium you're taking?
So I'm taking, well, let me think. I take calcium citrate with magnesium.
Okay, you don't have enough magnesium in there. To get it up to 500 milligrams of magnesium aspartate, it's the aspartate form. You have many different types of magnesium. You have magnesium glycinate, magnesium carbonate, magnesium citrate, magnesium aspartate.
Well, I have some glycinate by itself, but in the capsules of this with a citrate, with the calcium,
I know.
Three types. There's aspartate and citrate.
Okay, I know what's in it, but take it separately. Take it separately.
Instead of with the calcium?
Yes, and see if you can bring it down that way. Increase the amount of magnesium that you're taking and see if that brings it down. With the systolic pressure high like that, I suspect that it will bring it down. So, Maria, try that and let me know. Write us a note at rosellecare.com and let me know what happens, and then I can guide you a little bit more relative to that. But I'm pretty sure, based on, if you're telling me the blood pressure is high on the systolic side, but the diastolic pressure is normal, that's probably going to help you, and it's going to help you a lot. The other thing that you can take is vitamin B6. B6, especially in the phosphate form. Take about 25 milligrams 3 times a day, one with each meal, and that won't hurt you, but it acts as a very, very mild diuretic, and it'll get the liquid out of your tissue, and that will bring it down as well. Neither one of those things will cause you any problems, and there's no risk to it. Give us a call at 888-630-9625. That's 888-630-WMAL. Love to talk to you. Let's talk a little bit about vitamin D, so I keep my promise to the lady that called earlier on. A lot of surprising findings about vitamin D. And what we've known for a long time is that the majority of the patients over many, many years that we've taken blood tests on to find out what their vitamin D levels are, showing up really low. And there are studies after study that's coming out now that is supporting that. And so let me give you the guidelines first. If you get your doc to do what's called a 25-hydroxy vitamin D3 test, which is what we look at to find out what the levels are, you're going to see most laboratory ranges are going to go somewhere between 30, 32, up to 100. Anything under 50 is considered insufficient. Anything under 32 is deficient, highly deficient, and critical. Your target range, where you want to see it, is, in my opinion, and the literature bears it out, is around 70 to 75. At that point, you've got great immune response as well. Insufficient vitamin D is linked to everything in your body and every age-related deterioration, including cancer, particularly prostate and breast cancer, and the predisposition to other types of things, any problems with your blood supply, vascular disease, high levels of inflammation. If you have high levels of inflammatory processes in your body, you need to take vitamin D, period, as far as I'm concerned, end product. You're going to notice that you're going to feel better. Your energy is going to go up. Those of you who suffer with symptoms of SAD, seasonal affective disorder, are going to feel better. Now, how much vitamin D? Again, remember something. I am not your doctor, and I didn't take the blood test on you, so I don't know how to dose you specifically, but generally, Most adults in this area of the world, meaning that we're up north, we're not down in the sun, we need 4,000 to 6,000 a day from all sources, minimum. And you want to, if you're taking a therapeutic level of vitamin D, you want to make sure that you have a blood test within 90 days after starting it, find out where it is. So vitamin D, and oh, by the way, combined with vitamin A, we're finding that we have tremendous effect on chronic diseases of all sorts. The body begins to repair itself. So let's talk about that, and let's talk about why and what you can do and why it's so important. Let's talk about vitamin D's effect in combating infections. First of all, what I want you to understand, you live in the Mid-Atlantic area. You live in an area that doesn't get a lot of sunshine this time of year. When your shadow is a whole lot bigger than you, I promise you're getting almost nothing. So vitamin D levels go down in the wintertime. But those of you who are cave dwellers, you don't get outside much in the summertime because you're working, you go to school, whatever, and when you come out, the sun is kind of down. Or you're using soap on your body when you take a shower, or you're putting sunblock on, or ladies, you're using makeup. All of those things will block the absorption of vitamin D. Now, there's a lot of sources that you can get vitamin D from, but we want to, really make you understand that there's a problem here. Children with the lowest vitamin D serum levels are 11 times more likely to develop respiratory infection. 11 times. And that's coming out with study after study after study. 60,000 units were given of vitamin D per week for 6 weeks to children with frequent respiratory infections, and the result was, guess what? Complete, total disappearance of the infection in the following 6 months after therapeutic dosage. Complete. So we're talking about things that you can do for yourself. Do you have to take tablets? Some of you can't because of the oil suspensions. So you have to go to things like sun lamps. But there's all kinds of things you can do. Sun lamps work. You just got to make sure that you get in front of them and you don't do it with anything that's blocking your skin. So how does this happen? How does vitamin D, make you stronger and make things better for you and so forth and so on? Well, flu viruses, including, by the way, the swine flu and the H1N1 virus, induce massive inflammatory response that are able to take you out because of all the things that we talked about, inflammatory reactions in the body. So here's the deal. It's not the virus that's killing you. Remember Pasteur? I've told you many times, his deathbed, he said, I was wrong. It's not the bug. It's the environment. It's the inflammatory reactions within your body. Vitamin D decreases the expression of things that increase inflammation. We call them pro-inflammatory cytokines. That's what they're actually called. So all I want you to remember is things that increase inflammation. And they increase the ability of the body to be able to break things down, particularly tumors. So as people age, they often express the destructive pro-inflammatory cytokines. So we've got to make sure that, particularly as we get older, we get far more vitamin D, but we're seeing problems with children. The result with chronic low-level inflammation is simply this. We age. Yeah, we age, Our joints break down. We end up with cognitive problems. We can't think anymore. We wonder what happens when we walked in the other room and we forgot where our keys were. All of us have had that at one time or the other. We say it's stress. Well, it's more than stress. It's inflammatory. Vitamin D could save the lives of many people that are stricken with flu. We use it all the time. The combination of vitamin D and vitamin A will knock out most viral components as they have to do with flu at this time of the year. If you're looking at any microbial type of problem, vitamin D is the thing that you need to look at very, very seriously. Are there minimums? Well, the jury's out. We've talked about it. You've heard my opinion. You've got to really crank it up, but you have to watch the level. Is vitamin D toxic? If you get your blood levels up to 100 milligrams, 100 units in your blood, it's a little too high. You want to start knocking it down, and there's effect on the liver. But let me tell you something. I haven't seen anybody yet get it up to that level. People who are taking 4, 5, 6, 8, 10,000 units a day, and you're watching the vitamin D levels start coming up, and particularly when you're not taking them all in one clump, you're taking some at lunch, some at dinner, there's really no risk. And that's what the literature is showing. There's really no risk. There was a study that was done that analyzed the results of almost 14,000 blood tests who had their vitamin D levels taken, and what they saw was that 85% of these people had less than 50 units of vitamin D in their blood. 85%, highly insufficient. And half of those were deficient. They were 32 or under. So are you just going to sit there and say, well, my cancer is because of what? Your cancer is because of a lot of things that are missing in your body, your diabetes, your heart disease, the bone pain, and so forth. You add that to trauma, you add that to your stresses, and guess what? It's all controllable. It's something that you can do to make a huge difference in your body. Do you get the idea that you can change almost anything? See, that's my belief system. That's my belief system, is that you can change anything. As long as you're breathing, as long as you ask the right questions, and you can call me, by the way, anytime. Get me online at rosellecare.com. That's the fastest way of getting a hold of me. And by the way, I'm sorry I'm about a week behind in answering notes, but I'll get to the rest of them today and tomorrow. But we will get back to you. Or come in and see one of our docs, or come into one of our classes that we have every other week that we call our continuing education classes. Those are for you. Those are to give you the information that you need to take charge of your life. I wrote my book, Health is a Do-It-Yourself Program, Ageless Health 101, Health is a Do-It-Yourself Program. I wrote it for you as a manual to be able to direct your health, to take control of your life, because I truly believe that your health is in your hands. That where you are at this moment in time is because of everything that you do, or things that you don't want to do, or you forget to do, or refuse to do, or, have an attitude about. It's really in your hands.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. 888-630-9625. 888-630 WMAL. That's how you find me here, and how you find me other than here is rosellecare.com. That's ROSELLECARE.com. And I will get back to you. I'll answer your questions, and if you'd like to find out more, there's a couple ways of doing that. You can attend our in-house continuing education programs every other week. They're open to you. All we do is require a reservation. If you go to rosellecare.com, you'll see a listing of the upcoming events, things that might spark your interest, and our docs are available to you. They will take their time and answer your questions after every class. They usually run about an hour and a half. Sometimes, if they get a little verbose, it might be a couple hours. But you'll walk away with a tremendous amount of application. The other way that you can come and see us in the short term is simply this. Help us have a heart. Have a Heart campaign is sponsored by Roselle Center for Healing and Caring for Others, and that's coming up the 6th through the 11th of February in our office. And what we're doing is simply this. We're helping to raise food and money for the local food banks. Their inventory is low. They have some severe problems. We need to help those people out there who are struggling. And what we're going to do is this. We are going to exchange our services, chiropractic examinations, acupuncture examinations, normally starting at $225 and on up, for your donation of food or $50 minimum donation made out to Caring for Others, 501c3. And this is beyond a triple play. Roselle Center for Healing, Caring for Others, will match your donation. We'll figure out how much your food's worth and the checks that you give us, and we'll match those up to $100, and I will add money on top of that. We want this to be a heartfelt campaign. Please help us. Have a heart. Give our office a call, 703-698-7117. Tell my staff that you'd like to participate and have a heart. And those of you who've been patients and haven't been around for a while and like to come back in and, begin the process of wellness and creating your own wellness dream, you can take place of this as well. So give us a call. Have a Heart campaign the 6th through the 11th. 703-698-7117. By the way, take a tour. Go online. Go to RoselleRadio.com, Dr. Tom Roselle Live, and all of those things will lead you to a website that has all of our past shows. So if you missed one, if you'd like to refer a friend to it, you'd like to see what our blogs are, everything's there. So you can go in and check it out. Go to RoselleRadio.com. You actually can go back and forth from our website, RoselleCare.com. It'll all take you to where you need to go. Let me know if I can help you in any way. That's why I'm here. That's why I do the program. Let's talk a few more controversial things that are sitting out in the highways and the byways of healthcare. And what I want you to know is simply this, is that, ladies, there's a supplement that you can take. A lot of you try to stay slim and thin and try to keep muscle on and so forth. But when you don't eat, when you limit your dietary patterns, when you skip meals, when you get up in the morning, your body needs enzymes to run and to function. And if you're working out and you need those enzymes, guess what? It's going to eat you. As we get older, we have a tendency to have our metabolism slow down, growth hormone begins to diminish, and we begin to eat less because we don't feel like eating or we don't want to cook for ourselves, and we eat things that are fast, and you end up with a problem. Well, what you end up doing is you end up causing sarcopenia, and that's where your muscles get eaten by you. If you don't do anything, get yourself a solid protein supplement. Whey works pretty well for most people, and if you put that in your system before you work out, if you keep your energy levels high, you eat multiple times a day, you're going to balance your blood sugars, and your body's not going to eat you. But I'm serious, and I'm not playing with this. You can cause yourself some very significant, serious damage. Don't do it because it's avoidable. There's a lot that you can do to help yourself. And we're always available to give you the information, the answers. We don't mind your phone calls. If it's too extensive, we're going to tell you, listen, come in and see us. But otherwise, if I can give you a little bit of data, that's why I'm here. We're here every Sunday, bringing you the most up-to-date information possible. That's why I'm here. That's why I'm going to be here next week at 12 o'clock. I'll see you then. This is Dr. Tom Roselle.